I now welcome Dr. Blum to speak to us tonight on transference and countertransference. Thank you. Harold, please go right ahead. Yeah.
Jerry, thank you very much for that very warm introduction. It's a personal pleasure and privilege to address the Academy again. And I very much welcome and have enjoyed my long-standing relationship with Jerry. It's been really an honor to have Jerry as a close friend. Jerry has admirably summed up what I'm going to say in many respects. Transference has changed over the original formulations tremendously. It's not simply as we originally thought, a father transference, a mother transference, a sibling transference, a transfer of the past relationship to the person of the analyst or the psychotherapist. And we might ask, how has it changed? In what respects? Well, you've heard part of it. I want to emphasize that right from the outset, that the therapist, regardless of the psychotherapist or the analyst, the therapist is influenced by the realities of the situation. For example, the transference to the analyst and the countertransfer will be influenced by certain realities of the situation, such as the age of the patient, the educational status of the patient, whether the patient, for example, is a professor, is a noted professor at an important university, and so forth, whether the patient is male or female, young or old, and the patient is ill or infirm, either mentally or physically. A psychotic transference will differ radically from the ordinary transference of a neurotic patient. And the way we deal with it will be very different. So I want to emphasize how important it is in the way we work with transference and countertransference to make an initial adequate diagnosis. We must start with an understanding of whether we're dealing with a psychotic patient, a borderline patient, or a more ordinary neurotic patient. And we're reminded that everyone, as Freud pointed out, is further away or closer to the psychotic end of the spectrum, closer to a normality or closer to a really very, very sad disturbance of the person's absolute personality structure. And it's very important in our work with that, because there are psychotic transferences, as we observed in the Schreber case, that are very different from the transferences we deal with in our ordinary work with more ordinary neurotic patients, ourselves included. Now, the notion of the past in the present is still very much a part of what we consider in terms of transference, but it is also very different in different analytic schools and with different analysts. Not everyone thinks of the past and the present in the same way as in the original formulations of more than 100 years ago. We now recognize that there is an interpersonal and intersubjective relationship that occurs in all treatment. The interpersonal exists besides and alongside and influences the transference relationship. The two persons in the room, the therapist and the patient, an influence on each other than, in addition to, the unconscious transferences and counter-transferences that go on. There's an interpersonal communication. And there is, of course, a realization, much more than we thought in the early days, of the analyst's and therapist's values, interests, mode of listening, and so forth. We know today that there is selective listening. Some therapists listen intently to a report of a daydream or a dream. Others are more interested in developmental history, what the patient's childhood was like. Others pay more close attention to what is going on immediately between the patient and the analyst, and the patient wondering, is the analyst listening carefully to what I'm saying? Is the analyst sleepy? Is the analyst paying close attention to what I'm talking about in terms of my job, my employment, my marriage difficulties, and so forth? And indeed, all of us have their prejudices, biases, and selective modes of listening. There are many anecdotes about that, including the analyst who is very, very sleepy, but wakes up the moment a dream is reported, as if the dream was the only important thing to pay attention to. And there are many anecdotes about Freud also with the chow in his room, the dog. He actually kept the dog in his room, in the consulting room, I should say. And at one point, the dog yawned, and Freud said to the patient, even the dog is bored. Imagine the patient's response to that. The dog clawed on the door, and Freud opened the door and let the dog out. Then the dog clawed from the other side and came back in, where Freud said to the patient, he's giving you another chance. Well, today we would regard these as rather extreme reactions and involving a great deal of counter-transference, and also, in some ways, insulting and belittling behavior on the part of the father of psychoanalysis. Well, there are many, many anecdotes along these lines which indicate that transference is influenced by what's really going on between the two, the communications between the two, and the values, interests, prejudices, biases, and preferences of the two parties. This means, in today's way of understanding, that transference is co-constructed in what it has also been called in a bipersonal field. So it is co-constructed. It is not simply a rather pure transfer from a past relationship to the present relationship. It's even more complicated than that, because we know now that the relationships themselves are complicated. For example, the transference that appears is often a fantasy, not just the reality of what the relationship was like between a father transference and a transfer to the analyst. A patient may transfer a fantasy of a phallic mother, a woman with a phallus. Now, we know that this is a special kind of construction in fantasy, and it may have many meanings, but one prominent meaning is it is really a combination of father and mother. It's a woman with a penis, so it's that kind of combination. It's also a denial of castration and so forth, because the woman is not without a penis, but has a penis, and the little boy is not frightened that way, that the female, with a fantasy of female castration, that he too could be castrated. So we have all these complications, and we have a notion now of, as I want to emphasize, of co-construction, and that the field is a very complex field, a bipersonal field, and a field that is also influenced by society and culture. And a patient's level of understanding may vary tremendously. Some patients grasp what is going on in the transference and may even gather themselves something of the analyst's countertransference, but that is unusual. And the analyst no longer is an authority who just sits back and issues understanding of the transference relationship. It is really something in which the analyst and patient both participate in an enriched understanding which evolves over the course of therapy. Now, I've mentioned that the countertransference also is very important, and we notice that and the nature of the transference in the classical case of Anna O. I want to remind you a little bit of Anna O. What was striking, and is part of the landmark history of psychoanalysis, is that Breuer, Joseph Breuer, Freud's mentor at one point in his own development, was seeing Anna O 6 days a week for 1 hour a day. The relationship was extraordinarily complex and intense. It started out with hypnotherapy. He would he would hypnotize Anna O, and they would work through with hypnosis, retrieving memories of the past, which were highly disturbing to her. The relationship grew very, very close, very intimate, as one can imagine. The striking development that occurred was an intense transference between doctor and patient. Breuer was summoned to her bedside. She was moaning and convulsed with lower abdominal pain. And when Breuer inquired what was happening, she said, I'm having birth to Dr. Breuer's child. Now, Breuer was frightened, and we know now we would interpret his countertransference. He was extremely frightened of the erotic aspects of what had developed between himself and Anna O. And he fled. He couldn't deal with it. He was not unethical. Supposedly, he was very ethical, but he didn't understand the intense erotic transference that occurred where she had been impregnated and was giving birth to his child, and he fled on a second honeymoon with his wife. If he was going to have sex, it was very ethical. It was going to be with his wife, not with his patient, Anna O. Freud, looking back on it, as the case was reported to him, understood, and this was the beginning of really his understanding of transference, that he was fleeing from the erotic transference and his counter-transference fear of his own erotic attraction, which he couldn't deal with. So in this background, we can see that the transference and the counter-transference were locked together. The patient's intense erotic transference aroused an intense counter-transference, leading to his flight from the patient. Similarly, we have similar experiences just summarized along the way. For example, in the Dora case, Dora was brought to treatment. She had lived just down the street from the Freuds because she was suffering from aphonia, fatigue, generalized depression and anxiety, and she had suicidal thoughts and wrote a suicide note. And Dora's father brought her to Freud. He had only to go down the street, saying that Freud should bring her to reason. Well, bring her to reason went in the following direction, that she should be, that Dora's father should be permitted to carry on an extramarital affair with a lady we will call Frau K, friends of the family. And he didn't want this relationship, his affair with Frau K, to be interfered with. Dora wanted him to break up with Frau K, discontinue the extramarital affair, and so forth. Freud got caught up in this struggle. And at one point, Dora was concerned whether Freud was her ally or allied with her father. I won't pursue this further in going into the Dora case, but to illustrate again that the transference and countertransference are no simple matter and involve real aspects of the personalities and relationships that were going on, all in the context of that particular culture. For example, Dora's brother was a very prominent socialist. He became the head of the Socialist Party, became internationally renowned among the socialists and so forth, while Dora, in effect, could not even go to college. The girls were, in that culture, were not really well educated, and it was not considered important, valued, or appropriate for girls to have a higher college education. We saw the same thing with Virginia Woolf and so forth. So the countertransference is very important and is influenced by the transference, and the transference, as we saw with Anna O, is influenced by the countertransference. Now let's consider the countertransference in another respect. Let's take the case of a patient who we learn was abused as a child. And the therapist recognizes that the child abuse had a very powerful, enduring effect on the patient. And to further complicate matters, and not so unusual, the abuse was not at the hands of a stranger or a neighbor, it was by a member of the family. So it was incestuous abuse because it involved the father of the patient. It could also have been a grandfather, but in this case that I'm giving you, it was the father. Now the analyst may be appalled. As we know, there are now laws that one must report, and the father would be subject to actual arrest. In those days, that was not the case. And the analyst may be appalled and at the same time want to comfort the patient, understand the patient's grief and rage, and so on. And the analyst forms, we might say, a countertransference of a negative nature, of a hostile nature to the father of the patient. Now, that is not the same thing as a countertransference to the transference of the patient. This is a transference reaction, a countertransference reaction to the patient's father. It's very different. It's not a direct countertransference. As a matter of fact, the therapist may never having experienced an interview with the father in person. The countertransference is to someone he has had no clinical contact with. And the only way the countertransference has occurred has been the reports of the patient about the father. Very different from a countertransference to the transference of the patient, and not uncommon. We may all have reactions to the important objects in the patient's life other than the patient themselves. I think this term that we use is a concordant countertransference. The complementary countertransference is the transference that we saw was brought directly to NO. The concordant countertransference is to a countertransference to an important object or objects in the patient's life. Does this occur frequently? I would say yes. We all have reactions to the people we hear about but we never see. This occurs in almost every case. The patient may be having marital difficulties. We are treating the wife. We hear about the difficulties with the husband, and we may have a countertransference to the husband we have never met. This is especially important too in child analysis and child therapy, because I would say that if we are not directly meeting with some of the important objects in the child's life, there may be a countertransfer nevertheless to another important person in the child's life, a tutor, a nursemaid, and so forth. It is very tricky because we know very little about the concordant transference figure as opposed to the simple complementary transference directly to the person involved. Very tricky because we may assume we know more about the person and we may not tend to analyze in the same way in self-analysis our reaction to the unseen, unknown person talked about by our patient. I would say this is probably a universal reaction we tend to have, and it occurs probably in all therapy. And I think it's important that we approach this with humility, because the report we get about the parent or the nursemaid or the nanny and so forth may not be an accurate report at all. We're depending upon the report of the patient about someone we do not know, have had no contact with. We have to take into account that the report itself may be very biased and quite inaccurate. So that's why I say it's very tricky, and we have to spend considerable effort over time to try to sort things out and to try to understand as much as we can about the actual relationships with the other people in the patient's life and the concordant countertransferences. I think that we might say that in self-analysis, which is so important for us in terms of dealing with countertransference, that it's very important that we sort out as much as we can what we are bringing to the report, what we, in our own tendency to be biased and have our own preferences and prejudices and distort what we are learning from the patient, which themselves may be distortions of what they present about their particular object relations. Well, I want to go on too with another example of what we're dealing with. One of the most famous cases in the literature was the published report by Freud, Leonardo da Vinci in a memory of his childhood. And ever since then, generations of analysts have poured over the case and sought to learn more and more about this very great artist, one of the greatest artists of all time. And Freud's interest in the Leonardo situation only spurred further generations of analysts to investigate. Well, let me tell you that Leonardo was treating a patient. I shouldn't say treating because Leonardo wasn't a therapist. Leonardo was retained to paint a portrait of a lady named Lisa Giardini. She was the wife of a wealthy cloth merchant. And she was retained by her husband. Leonardo was retained by her husband to paint his wife's portrait. He started to paint the portrait of Lisa Giardini. And lo and behold, as the situation evolved and he was going on with the painting of the portrait, he changed his mind. Leonardo changed his mind. Instead of completing the portrait, he returned the money to the merchant and he kept the portrait for himself. He actually took the portrait wherever he went. And since he was a confidant of the King of France, I think his name was Francis I, and the Francis was had an extraordinary appreciation of Leonardo's talents and loved to chat with him and converse with him on all matters of interest, whether it was artillery or wars or literature or art and so forth. So Leonardo proceeds to work on the portrait for himself, and he dies. And the king is a very discerning king, having so much appreciated Leonardo's talents in so many directions. The King of France decides that he will retain the portrait, pay off Leonardo's heirs, and keep the portrait for himself, which he does. And when he moves from France, southern France, to Paris, to his castle in Paris, he takes the portrait with him. Leonardo has worked on the portrait until his own death. Now the portrait is now in the king's castle in Paris, but the king's castle, after the king's death, becomes the Louvre. The castle is transformed into the special museum in Paris of the Louvre. And that's how Lisa, the Mona Lisa, becomes a central portrait, one of the most, I would say probably the most famous portrait in the world, in the Louvre. Today it is, of course, under careful guard and can only be approached to a certain degree. I can't go into it. At one point, it was years ago, it was stolen and brought back to Italy because the person who stole it thought he'd be greeted like a hero, bringing the portrait of the Italian lady back to Italy. And that didn't turn out to be the case. You may be interested to know that at the time, none other than Picasso was included among the subjects who thought to be might have thought to be involved in the theft of the Mona Lisa. But today that would be impossible because it is surrounded by all kinds of electronic devices. And when it is cleaned once a year, It is cleaned in the presence of the chief of police and special circuitry, and all the exits and entrances to the Louvre are patrolled by the Paris police. So this is the origin of the Mona Lisa. And who was the Mona Lisa? Why did Leonardo take it with him wherever he went? Well, in my view, and which I've written about, the Mona Lisa really is Leonardo's birth mother. He was an illegitimate child. His birth mother was an indigent orphan. And without going further into the background, this indigent orphan is transformed into the most famous portrait in the world through her illegitimate son. She was impregnated by, it was often the case of 15, 16-year-old girls, by Leonardo's birth father, who was a very well-to-do accountant, and he made arrangements for Leonardo's upbringing in these unfortunate, very, in certain respects, tragic circumstances. When his birth mother reappeared later on in Leonardo's life, he had never had he was gay. He never had a woman before in the house, but he took his birth mother immediately into the house. And now, instead of being treated like an indigent outcast, he was waited on hand and foot and presented to the King of France and so forth. So we can see here that the interesting transformations that have occurred over the course of a lifetime and the way in which society and culture and context are in all of this too. It is certainly the case that the appreciation of art by Freud and those who came after him was very important in a number of different ways. And now I bring up the transference to the spectator and the counter-transference of the spectator. The reactions to works of art and literature and so forth, it could be to astronomy as well as to other aspects of science. There are transferences and counter-transferences that are important in our understanding of the way in which we understand art and literature and astronomy and so forth. And the role of the spectator is significant from many different perspectives. The role of the spectator is one role. What the spectator brings to the appreciation of the work of literature or a work of art we're talking about, what the spectator brings to the work of art is the spectator's own reactions and his own transferences to the work of art. And in the case where the spectator knows something about the artist, or if it's a living artist, then there's a reaction of the artist to the spectator and the spectator to the artist, as well as to the work of art itself. And now we know that the transferences and counter-transferences there are important in the way we come to appreciate a work of art. And as I said, this could be a work of science and literature and so forth. So that brings me to this point of saying that we're always dealing with complicated reactions, no simple understanding of transference and counter-transference as in the past. And it is incumbent upon the therapist to always engage in self-analysis. Very important to be able to really appreciate the complexities of the transference, counter-transference situation. And I wanted to conclude at this particular point with the statement that one of the finest results of one's own therapy is the capacity for self-analysis. And we must depend upon that to really understand in depth the transference and countertransference that we're always dealing with. And also our attempts at reconstruction of the past very much depend upon the way we look upon various memories and lack of memories that are selected by patients, and the way in which we begin to ferret them out and realize what is probably appropriate and realistic about our reconstructions and what is our own fantasies. And so now I leave it for a break and for further commentary and question.